Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists physician assistants with employment contract and independent contractor agreement issues. Today I'm going to talk about physician assistant contract red flags. So, what are some of the main areas that I discuss with PA when we're going through a contract review? And then, alternatively, what are some major areas that I get calls from after somebody has signed an agreement? Maybe they want to leave and terminate it, and there's some negative things that are going to follow them. So first, being specific about the compensation. I'd say most PAs, or at least the majority of PAs, are just paid a straight base salary. Very simple. No productivity bonuses, no RVU requirements, no collection percentages. It's just, we'll pay you $120,000 for the year, and you work the hours, and that's it. Now, if you are on some kind of productivity-based compensation, if you're in a hospital, a healthcare network, it'll usually be RVU-based. If you're in private practice or an outpatient clinic, it'll usually be collections-based. So the biggest red flag would be timing of bonuses, meaning if you have some kind of net collections model where you're paid via whatever the practice receives, you want to make certain there's very specific language about when those bonuses are paid, when the reconciliation occurs, and then make certain there's language that say any earned bonuses will be paid out even if you're no longer employed at the practice. So, I've seen contracts where there's no language about when the bonuses are paid, and then it'll say the compensation ends as soon as the contract terminates. And so if a PA is paid on collections, and let's say it's a 45-day accounts receivable cycle for an insurance claim, for the last month they're working for the employer, they're working for free because they're not going to get any of those collections after the contract terminates. So that's a big red flag, and you want to get that fixed. Overbroad restrictive covenants, so non-competes, non-solicits is another red flag area. For a non-compete, you want to make certain and this is very important for PA, it needs to be the specific thing that you're doing for that employer, meaning the restriction shouldn't be you can't practice as a physician assistant for 1 year and 10 miles from the practice. It should be, let's say you're working in an orthopedic practice, then it needs to say you can't work in orthopedics as a PA for 1 year and 5 miles. Or if you're in doing primary care, you can't work in primary care, but it would allow you to do urgent care and hospitalist work and maybe work in the ED. You just want to have flexibility to continue to get through whatever that restricted period is. If you're working as with a cardiologist, it makes no sense that they would care that you're working in pediatrics or primary care. They're not competitors. So be very specific about the scope of the non-compete. Next, malpractice insurance. Who is paying for your underlying premium? What type of policy is it? If it's a claims-made policy, who has to pay for tail insurance? These are all things that need to be spelled out in the contract. They can't be ambiguous terms. Now, tail insurance for a PA is not prohibitively expensive, but it still can be, $3,000 to $4,000. And so you want to make certain that it's clear who has to pay the tail insurance. Repayment obligations if the contract is terminated. So maybe you're in the first year or two of the contract, you received a sign-on bonus or relocation assistance. The contract's going to say most of the time that you're going to have to pay back a prorated amount of those bonuses. If you leave within the first year or two of the contract, you want to make sure you shorten that interval. So having it forgiven on a monthly basis is certainly much better than an all or nothing. You have to stay for the full year, the full 2 years, you have to pay the entire amount back. So that's a big red flag, and you can avoid having to pay a significant amount of money by making sure it's a monthly or quarterly forgiveness versus an annual or maybe a 2-year forgiveness as well. Those are just some big red flag areas that you should think about as a PA. Obviously, there's many more than that, but for this video, I'll just hit the kind of major ones. If you have any questions about your employment agreement or independent contractor agreement, feel free to contact my law firm. at the information listed below in the description. And I appreciate you watching the video. All right, take care.